And how does Feldenkrais work on like a chronic pain patient? Is it effective in chronic pain patients?
Oh, absolutely. Yeah, absolutely.
Can you share with us, possibly some experiences you had with chronic pain patients? Because we seem to
Yeah.
all be accumulating more chronic pain
Correct.
patients now, and we have to change our narratives in terms of pain science.
Yeah. I love that question, actually. One of the themes of chronic pain science, is that we have these sort of, you can call them neurotags.
Neurotags.
Right. That in the loop of chronic pain, that there are certain associations. So in other words, every time I bring my shoulder forward, I have neck pain. Could be one. I have SI joint pain every time I stand on my right leg. I get hip pain, groin pain every time I play ice hockey. Whatever.
And you call them neurotags.
Neurotags.
I called them asterisk signs.
Asterisk signs, exactly.
My training was asterisk signs. What is your asterisk sign? Identify the asterisk sign and see if you can get a change and keep reassessing it.
But this is how fear avoidance happens, right? It's like, I know that thing hurts me, so I'm not going to do it.
Or you've been told it's going to hurt you.
Or you've been told it's going to hurt you, so you identify that. And Feldenkrais is a really beautiful way of not somebody telling you anything, but you experiencing that that's not true, that you can do things you don't think you're able to do. But it's through your own process of learning what feels good to you, what makes sense. Because think about it, there's so many different ways a person can twist or bend. There's not just one way.
Oh, absolutely.
Yeah.
The word alignment has been bastardized,
Right.
excuse my English, for
I
so
agree.
long. But
I agree.
you and I know as well that alignment, your spine is a resilient structure. It doesn't bend out of place. Now, if you have a scoliosis,
It's not out.
It's not out. Backs
Yeah.
don't go out. If they did, we'd have a serious problem.
Yeah.
We'd have real neurological tags.
Yeah.
Many real. But a scoliosis to me is the only thing that's out of alignment. It's just there. There's no way around it. There's a curve. You can't dress it up. You can't hide it. It's there. But when somebody says to me, well, I'm out of alignment, I look at their spine. Your spine is straight to me.
Yeah.
But what's out of alignment is their perception.
Right. And so I guess that connection between perception and movement is what's missing, right? What's wrong in that situation is not their perception.
Right.
It is, but it's also the fact that they can't move. So their perceptions are out of alignment. What they're really saying is, I can't move. Because if you can move in every direction, you're not going to have a perception that your alignment is off. The alignment is the sum of its parts. Does that make sense?
Exactly.
Yeah.
That's actually really good. I'm going to have to steal that from you. The alignment is the sum of its parts, and those parts may be coming from your brain.
No, and they are coming from your brain. Why else? Why else move?
So if we change the perception of that person, we can actually get them to move because we've empowered them that, hey, your back is not as bad as it is, or your back can heal. You can put weight on that limb.
Yeah, but it's not a convincing, it's more of an experience.
It's a
that
process.
Somebody
And you have to
experiences.
trust it.
Yeah, and what you were saying before about the words, I think the words, when they have meaning to someone, when someone feels like, oh, you understand what I'm saying, you're there with me, that's kind of how they start to change or unravel. So maybe that's part of what you were describing, yeah.